Hi, this is Dr. David Zahalik, and I have some more information for you on MRSA. MRSA is the resistant kind of staph infection that's resistant to the usual antibiotics, especially the penicillins and the cephalosporins. So, a couple of key points. You'll see some of these in the associated article, and some won't be. But the first key point is if you have what looks like a spider bite, but you don't recall being bitten or stung by anything, be careful about that. That has a good chance of actually being an MRSA infection because it can look the same way. So spider bite, but no history of bite, think MRSA and get that one checked out. The second point, which is if you have some kind of infection on your skin that's producing pus, make sure to go to the doctor and get it cultured, because a culture is a way that we can positively identify what's the germ causing the pus, and we can identify if it's MRSA, and identification is key to choosing the right treatment. If you are given medicine for a skin infection, please make sure to take it all. Again, the characteristic of MRSA is its resistance to conventional antibiotics. So even if you're given the right one, but you don't finish the antibiotic, you might run into a bigger problem later. The next kind of key point I want to mention was if you're diagnosed with having MRSA, make sure to do everything that you're asked to do in terms of not only taking the medications, but doing the preventative treatment afterwards. We know that a portion of people are colonized in their nose and on their skin with MRSA. And so there's things that you can do to get rid of that and to eradicate it in the carrier state. So it's important to do that. So in addition to taking all your antibiotics, and you may have to wear sunscreen, by the way, when you take antibiotics. But when you're on antibiotics, you should wash your sheets 3 times a week because, again, that germ can be kept in the sheets. And then things that we do to eradicate MRSA from the nose and from the skin is we ask you to get some Bactroban ointment, and that would be prescribed for you, and to put it on a Q-tip into your nostril twice a week for a year. And it's easy to forget and fall off of that, but it's important to do it for a whole year. And also, we ask you to wash your skin with HipaCleanse, which is bacteriostatic to the MRSA, 3 times a week, again for a year. So a lot of people will start and then they'll fall off, but you want to stay with that because if you can eradicate that carrier state, it's definitely in your best interest. And then also be careful about certain environments. Good examples, if you or you have a child is on a football or wrestling team, again, that's a setup for MRSA. So I know in those situations the athlete can't not touch the people they're with, but they can do some of the other things like washing with HipaCleanse and going right to the doctor if they look like they have an infection. If you visit someone in the hospital or in a dialysis unit or even in a jail, you have to be careful as well to avoid shaking hands. Don't shake hands with any medical staff and wash your hands carefully and consider wearing gloves. I mean, it certainly wouldn't be out of place in a hospital to be wearing gloves, but you may decrease your chances of getting something that way. So, just some information for you to be aware of to help to decrease your chances of getting MRSA and to eradicate it if you do get it. Thank you.